Earlier this month, Governor Janet Mills signed a law requiring screening for a potentially debilitating virus known as cytomegalovirus, or CMV, in some newborns.
CMV is considered a common virus that causes no serious symptoms in adults, but some babies exposed in the womb can develop severe health problems, including hearing loss, developmental delays, and even seizures. The law would also raise awareness of how to lower the risk of the virus.
News Center Maine's Vivian Lee has our follow-up.
With a stroke of a pen, Maine joins more than a dozen other states which have approved laws addressing cytomegalovirus, also known as CMV. Beginning next year, every infant in Maine will be tested for the virus after failing 2 hearing tests. Right now, the Maine CDC's newborn blood spot screening program screens for more than 24 conditions. CMV is a common virus that often circulates in daycares. It can present like the common cold or flu or present no symptoms at all, but it can lead to severe complications to an unborn child.
Women can become infected with it during their pregnancy, and that's when the baby could become infected and harmed by the virus.
Dr. Stephen Meister is a developmental behavioral pediatrician at the Edmund N. Irvin Pediatrics Center in Augusta. He treats children with CMV and helped come up with a list of recommendations to address the virus in Maine, including flagging other symptoms in newborns who may not have the obvious signs like hearing loss.
If a baby has a rash called petechiae in the skin, if a baby is really small for gestational age.
According to the U.S. CDC, CMV affects 1 in 200 newborns every year, and about 20% of babies infected will develop serious health problems. That includes deafness, hearing and vision loss, seizures, and developmental delays. But in a number of cases, early detection means these babies can be treated with a prolonged course of antivirals, which can help symptoms.
The option of even discussing antiviral treatment, whether they would have been appropriate or recommended for her, we at least would have wanted to have that conversation with her care team and not miss that window of opportunity.
Laura's daughter Jane failed her newborn screening, but it took a year of seeing different specialists before her daughter was finally diagnosed with CMV and fitted with cochlear implants for her hearing loss. Laura's young son was in full-time daycare at the time, but she was unaware of the risk for CMV while pregnant. Her daughter is now 7 years old. Jane is thriving in first grade, but the little girl still faces challenges and relies on a remote microphone system to help her hear teachers and coaches. And following 6 years of lobbying to educate women and doctors about the virus, Laura is hopeful it will lead to better long-term outcomes. In Cumberland, Vivian Lee, News Center, Maine.
The Maine CDC has until next February to develop CMV screening guidelines and an education campaign for both doctors and patients. We're going to have much more on CMV on our website and our News Center Maine app.